Welcome and thank you for standing by. All participants are in listen-only mode. Today's webinar is being recorded and the recording will be posted publicly. If you have any objections, you may disconnect at this time. Now, I would like to turn the call over to your host, Linda Lee. Thank you.
Thank you, Victoria. Good afternoon, everyone. My name is Linda Lee, and I would like to welcome everyone to another fantastic year of the Exploring Census Data webinar series. For those of you that have been following our series, welcome back. For anyone that may be new to our series, the Exploring Census Data webinar series is a set of webinars where we present data from the Census Bureau by topics. Other features of the series, the webinars are presented on a monthly basis, so please stay tuned for new and exciting topics in upcoming months. Another feature includes access to our archived copies, and the recording of this session, along with the slides and transcript, will be available in about 5 to 10 business days. Today's webinar is the second in the series, the first webinar on the services sector broadcasted in April. If you have missed it, please visit the Census Academy on census.gov. Today, we will be providing you with information and data on the healthcare sector of the economy. You'll learn about both business and demographic data available to help you with your research and make informed business decisions. Now, with that being said, we have lined up 4 speakers for you today that are experts in their field and ready to impart their knowledge on the topic. You'll be able to ask questions using the Q&A feature throughout the webinar, and our experts will be available to you at the end of the presentation as well. Up first is Ms. Tara Dryden. Tara is a supervisory survey statistician representing the healthcare and educational program area. Tara will be presenting information about the healthcare sector from the Economic Census. Following Tara is Ms. Caroline Jackson. Caroline is a supervisory survey statistician from the same program area and will be covering the healthcare components of the service annual survey. After Tara and Caroline, we have Mr. Aaron Finkel. Aaron is a survey statistician from the annual business survey, also commonly referred to as the ABS. Aaron will be diving into the demographic components of the business data from both the ABS and its counterpart, the non-employer statistics by demographics. Then our next speaker is Ms. Amanda Klimek. Amanda is a supervisory survey statistician from the American Community Survey. Amanda will be presenting the demographic aspect of the industry as it relates to the nation's population. Now, before we dive into today's session, please note that we are utilizing technology off-site, and we aim to provide you with the best experience possible. Should we experience any technical delays during our session, please utilize the chat feature to let us know of issues, and we will mitigate them as soon as possible. On our agenda for today, we will be diving into a brief background about the Census Bureau before we explore the healthcare sector. Please take note towards the bottom of the slide that we provided a location of our archive recordings for you here. Along with that, if you are interested in stories behind the data, please check out the America Counts page where you'll be able to access the stories. We also have data visualizations that you can use for your own needs as well. Now, all of these resources are free and available on census.gov under the library section of the site. The Census Bureau is the federal government's largest of the 17 statistical agencies, where we conduct over 130 surveys each year with some of the well-known surveys listed here. So first on the list, many people recognize the Decennial Census, which takes place every 10 years, and it counts the population and housing. Next is the American Community Survey, which is a yearly survey on the nation's population. Now, from the business data side of the house, we have the Economic Census that measures American businesses. Now, for the public sector's counterpart of the Economic Census, we have the Census of Governments. This is the official 5-year measure of the nation's state and local government sector. So our mission is to serve as the leading source of quality data. With that, it may be helpful to know the structure of our data releases. We have a range of release frequencies from the decennial to quinquennials, annuals, and monthlies. And it's good to note that there is an inverse relationship between frequency of releases and the level of details. So for instance, using the surveys listed on this slide, the Economic Census takes place every 5 years, and it is the most comprehensive source for business data. While the service annual survey is more timely, the level of details is reduced. Here you'll notice that for business data, we have 17 monthly and quarterly surveys, with some of our widely used ones such as the retail and wholesale trade surveys listed here. The monthly and quarterly surveys include programs that serve as key economic indicators. And we also have 20 economic surveys that are released annually. So with over 130 surveys, I highly encourage you to check out our site and discover all the possibilities. Because the economic census is our largest undertaking for business data, it's good to know that it takes place every 5 years in the years ending in 2 and 7. So with the 2022 economic census right around the corner, the survey will be conducted in 2023 with the businesses reporting their 2022 year-end numbers. And to learn more about the programs, please use the link in the third bulleted point here that will take you directly to the program's main page. Data is available to you for free for nearly every industry and geography down to the place level. And this type of information can be helpful in making informed business decisions. With that, I would like to turn the presentation over to our first speaker, Ms. Tara Dryden.
Hi, good afternoon, everyone. My name is Tara Dryden, and I do work in the economic area, as Linda said, and I'll be presenting on healthcare for the economic census today. So just a quick overview. Sector 62, healthcare and social assistance sector, includes 892,000 establishments within 651,000 firms. We publish our data every 5 years at the national and lower geographic levels for each industry by tax status. Moving on, I just want to give a quick overview of Sector 62's NAICS hierarchy. So basically, NAICS stands for the North American Industry Classification System, in which the United States, Canada, and Mexico have jointly agreed upon industry classification so we can compare our economic data. The healthcare and social assistance sector is comprised of 18 different 4-digit industry groups shown on the screen here, and you can dive deeper into the NAICS structure at census.gov/NAICS, located at the bottom. So I'm going to go and show you some of the data we publish. The Economic Census publishes data in in 2 different groups. We have the core reports and our sector-specific series. So the core reports are the same data tables for all of our industries across the economic census, the same for retail, wholesale, manufacturing, and healthcare. So this is the first data table in the core reports. This is our summary statistics, which includes our basic items across the top for each industry by tax by geography. In the chart to the right, you can see that NAICS industry group 622 hospitals generated approximately 42.4% of the sector's revenue. Next, in the core reports, we publish our comparative publication, and this data table publishes data for the United States and states for each industry for both census years, the current year and the prior year. And for this table, it's 2012 to 2017. The difference in this table compared to the summary statistics you saw before is we published the 2017 data using the 2012 NAICS basis so that you can compare the data and see the growth over the 5 years. But please note, the estimates have not been adjusted for price changes. The third section of the core reports is our product data. And our products publication breaks out total revenue into smaller categories. So for healthcare, we do target the collection for most of our ambulatory healthcare and hospital firms to report their revenue details based on the ICD-10 categories. And in addition to the ICD-10 categories, the box on the right will show you a couple of the other categories we collect in our sector. So here's an example of part of the industry by product data publication. I've selected 6 of the broad NAPS collection codes to show you just a small sample here. And as you can see, the patient care ICD-10 major category line represents approximately 63.4% of the sector's revenue on the second line there. And then if you were to dive deeper into the publication, each one of these broad categories will be broken out into smaller details. For example, the patient care line will break down into 20 more details, which are all the ICD-10 codes. And for those of you guys who are not familiar, the NAPS is similar to NAICS, where it means the North American Product Classification System, in which the 3 countries have agreed upon classification of their products, which are the breakout of your total revenue. The fourth group in the core reports are the establishment and firm size publications, and we produce 7 different tables that break out different types of sizes. Below in the bottom right, I listed a couple facts you can get from these tables, such as single unit firms represent 95% of the firms in healthcare and social assistance. The top 50 firms generated 18.7% of the sector's revenue. And then 2,139 firms generated over $100 million for the year, while 56.4 thousand generated less than $100,000 for the year. This is the first table of the establishment and firm size tables, just to show you what they look like. They all have the same data columns across the top. And then on the left side going down are the different size breakouts. This particular table is single unit versus multi-unit. And you can see on the second row where single unit firms represent about 95% of the total firms. So after moving out of the core reports, we have our miscellaneous subject series. These are the industry specific tables. So for the Economic Census, Sector 62 produces 5 different industry specific tables. The first 2 tables here break out revenue by different categories, but it's slightly different than the products table. The products table broke everything out, if you recall, a couple slides ago by the ICD-10 codes, where these 2 tables have different breakouts. The first one by type of payer will break out total revenue by the payer of the service, such as Medicaid and Medicare are 2 of the breakouts. And then the second table breaks out the total revenue for patient care revenue. Not all of the revenue, but just the patient care revenue into smaller categories. And some of those are visits and consultations, surgical and non-surgical interventions, laboratory services, diagnostic imaging services, and a few others. Moving on to our third miscellaneous subjects table. This is our government ownership and control table. And you can see on the top left, I just put NAICS 622-1101, general, medical, and surgical hospitals for government. And you can see the breakout amongst federal, state, and local. Then within NAICS Sector 62, which is healthcare and social assistance, I do want to point out we do have 2 tables for social assistance. The first one is our grants and transfer contributions. So we produce the operating expenses, the grants and transfer contributions, and the net expenses, the last 3 columns, for our social assistance industries. And this is just a snapshot. And then the next table is also a revenue breakout. This breaks out the social assistance revenue by government payers and private payers. So basically, as an example, government payers contributed approximately 80% to the social assistance revenue for child and youth services. So that concludes the individual tables for the Economic Census for Sector 62. And I just want to dive into the website really quick as an overview. On the first 2/3 of the screen, if you dive into www.census.gov, and then on the blue bar, click on Browse by Topic and select Business and Economy, this is your main landing page for all of the economic surveys and data sets. On the left, you have links for like about the American Count stories, getting to the data tables, news and updates, and surveys and programs. So some of the surveys you're about to hear, you can go here and link into these surveys. And for the Economic Census, on the right, on the top row, you'll see a link to the Economic Census. Now, I did mention you can go to data on the left and go deeper into the data tables, or you can bypass all of this. And in the very top right, you can just go to data.census.gov and you'll get this website page here, Explore Census Data, where you can just dive into all of our data tables. As I mentioned on the left, the American Count story. This slide is just some pictures of some different stories. Like Linda mentioned, I highly recommend reading them. They give you some tidbits about our data. You can find out how data users are using our data. and some of the stories will explain how to read some of the data tables. For example, the story in the middle here helps you understand the comparative and bridge reports. So I just want to put a plug for the Economic Census there. So I'm going to do a live demo to get to some of our data. For those of you who haven't seen it before, there are multiple ways to get into the data, but on the previous slide, I'm just going to go straight into data.census.gov and start from there. And I provided 2 of the links for the pages that were on the previous slides. Sorry. I am going to go fast due to timing, but if you guys have any questions and get stuck, I do want to let you know. Sorry, guys. You can request a training from our data dissemination specialist. They'll train you or a conference or your company or whoever you need training for. So I'm going to start with the live demo here. And like I said, I'm going to go to data.census.gov right here, and I land on this page. So getting to our data, most people want to start right here in the search bar, but the search bar can be a little bit tricky. So I highly recommend going to the advanced search right here underneath. Okay, and you can filter on the left, and you can also filter inside your tables. I like to do my higher level filters over here and then my detailed filters inside the table. So since we know we're talking about the 2017 Economic Census, I'm going to start with those 2 filters. I always prefer to start with years, and we select 2017 box. And then we're going to go to surveys and select the Economic Census. When you get here, we have the core reports and then the sector specific ones. I'm going to start with the core reports, which cross over all the tables for all of the industries in the Economic Census. So when you click on core reports, you can see here the comparative table I talked about earlier, the establishment and firm size, and some additional tables. But for today's demo, since I'm only going to do 1 or 2 tables, I'm going to take you into the very first table I showed you, the summary statistics for the United States and selected geographies. So make sure you click the table that says geographies. So we'll check that box. And then we do need to click search over here because this is a filter. And this is going to pull up all of the summary tables that we have. The very first table is all sectors together. Now, you may not want to open that large of a table, so we're going to scroll down and find the individual one for healthcare. So we have mining, utilities, and we'll just keep going down until we find healthcare. We're going to click View All Tables, and I do know it's on the second page. So we'll scroll down until we get to the Healthcare and Social Assistance table. And just for reference, the table name starts with EC for Economic Census, 17 for the year, 62 for the sector, and the basic. So these are sorted in order by the sectors. So you're scrolling until you get to 62, sector 62. I'm going to click on the table. And when we arrive to any of our data tables, they always default to the highest levels. So it's going to default to the highest NAICS level, 6.2, and the highest geography, the United States. But we want to drill down and get some more data. So this is where I prefer to start drilling down across the toolbar right here instead of on the left. So I'm going to hit the double left arrow and close the panes. And I'm going to start in here. So the first thing I want to do is I'm going to click on codes, and I want to add additional NAICS industry codes. So when we click on codes, we want to pick industry codes NAICS. And then we're going to click healthcare and social assistance. So in here, we're going to select a couple codes, and I want you to think about these as folders. So we're going to start with hospitals. I'm going to open the hospital folder. And the NAICS structure, the deeper you go, in the NAICS, in the numbering, the deeper you'll get into the industry details. So we're in hospitals. I'm going to click the folder for general, medical, and surgical. And I'm going to click that box. Every time you click a box, it's going to add it to the table. So click the box here. And then I'm going to keep going deeper into the folder structure, which is the NAICS structure. And I'm going to click again because I want to get to government versus non-government. So I'll click the government folder until I get a white box, and I'll select it, and you'll see it populate. I'm going to click the back arrow, come here into the non-government folder, click that, and it keeps adding it to the system. So I'm going to add one more code. I'm going to go back to codes. I'm going to click the back button, come back out to the front. And I'm going to add dentists. So I'm going to go to 621 or ambulatory healthcare. I'm going to find dentist folder, and then I'm going to select the dentist. So now I have the industries I am interested in getting data for, the dentist and the medical and surgical hospitals, and you can open and close the columns as you wish. And we have the government and non-government, and then we have our data to the right. But now I'm going to add a couple geographies and show you how to do that. So we'll select geos, and we're going to add 2 states. So I'll click on the arrow for states, and I'll add California, and you see it's populating, and Colorado. So now we have California and Colorado. I do want to note the default highest level US and 6.2. Once you start manipulating your table, the default options are going to disappear. So if you do want to see the US level, go back to geos, click the back button to get to the beginning, and go back to nation and add the United States level back on. And it'll bring it back on. Here you go. And I'm going to add one more geography. We're going to go back to geos, click the back arrow to the front. We're going to pick county. And since the Census Bureau is located in Prince George's County, Maryland, I'm going to click on the Maryland folder and add Prince George's County. And there we go. We've got United States, California, Colorado, and Prince George's County for the industries we want to select. Now, if you do not know which industries you really want to look at and you want to see everything in the sector, you can go back to 123 codes, go back to the beginning of healthcare, and you can click all available NAICS right here, and it'll bring everything on and populate your table. So this is the example to get to our summary statistics by NAICS, by tax status for lower geographies. And up here on the left, you can see there's 11 filters, and you can click on that and then do view 6 more, and you can remove some filters if you want and just X them out, remove California, etc. Now, if you want to get to another table and you don't want to unfilter and go backwards, the quickest way is just to click on the census logo, and it'll bring you right back to the front. So just as a recap, before I pass this along to Caroline, we're going to go to the advanced search. We're going to go to years, click 17, surveys, economic census, and then you can go into the core reports, or you can click summary, and we can scroll down here to the individual sectors, and this is where you'll find healthcare and social assistance, ownership and control of government hospitals, the type of patient care, type of payer, etc. So with that, I'm going to pass this along to Caroline to talk about the services annual survey. Thank you.
Thanks, Tara. So my name is Caroline, and I'll be discussing the Service Annual Survey, which is often referred to as SAS. Like the Economic Census, all of the Service Annual Survey's data products are disseminated based on the same NAICS structure that Tara explained. I won't go over it again, but just wanted to highlight that all the data products I'll be talking about will follow the same exact NAICS hierarchy. For a little bit of an overview, as the name suggests, the Service Annual Survey is conducted every calendar year. It produces national estimates only. And in addition to breaking down our data products based on the NAICS structure, for some industries, estimates are also broken down into tax status categories as well. So whether or not a firm is subject to federal income tax. The Service Annual Survey covers 12 sectors of the economy, including the healthcare and social assistance sector. Data is collected and published for employer firms only, except for employer plus non-employer total revenue estimates at the sector, subsector, and select industry groups. However, all the SAS data that I'm going to be talking about for this presentation are for employer estimates only. We typically release each year in November, and the data that will be featured in this presentation is from our most recent publication covering survey year 2020. Along with data tables, the Service Annual Survey produces interactive data visualizations and a summary brief, and these data products, as well as information about the survey, can be found on the links provided on this slide. We disseminate general content like total revenue and total expenses for all 12 sectors. We also have several healthcare specific data products that I'll mostly get into and try and cover today. This slide lists all the data products and we'll preview most of them. So getting into the data. SAS is a time series survey, and most of our data products cover several years. Some even go as far back as 2013. However, I'm going to be highlighting data from years 2020 and 2019 today. 2020 was a very unique year for the world with the COVID-19 pandemic, and this was especially true for the healthcare sector. I think taking a look at the Service Annual Survey through the lens of that first year of the COVID-19 pandemic is not only interesting, but it also demonstrates the utility of our data products. We provide estimates for total revenue for all NAICS in the healthcare sectors. Included here on this slide are estimates for total revenue for the sector, as well as all the subsectors. A lot of the healthcare data products that I'll focus on today are for hospitals and ambulatory healthcare services, and those are our two largest subsectors. In addition to providing total revenue estimates, we provide estimates on sources of revenue, as well as a breakout of total revenue by tax status. So here's an example of our sources of revenue for hospitals. And what we're really capturing here is who's paying for the services provided in categories like Medicare, Medicaid, private health insurance, and patient out-of-pocket. I chose to feature hospitals because they were really on the front lines of the pandemic in the year 2020. We saw an increase in total revenues from 2019 to 2020, as well as an increase in revenues from all other non-patient care, and that's the last revenue source listed in this data table. While not normally considered one of our more interesting revenue sources, hospitals were the recipients of large amounts of provider relief funds in 2020, and those funds were likely reported in this all other non-patient care line for many healthcare providers. Switching to the expense side of things, the Service Annual Survey collects and provides estimates on total expense. We also break out total expense into estimated select expenses. Included are categories like payroll and employer costs for fringe benefits that we collect for all of the service sectors, but also collected here are some healthcare specific items, including medical supplies and professional liability insurance. Lastly, since 2015, we've collected and published data on expenses related to buying and maintaining electronic healthcare systems, and estimates for this are provided for all NAICS except for in the subsector social assistance. Looking into more of our healthcare specific data products, for hospitals, we provide data on total number of inpatient days and outpatient visits, as well as revenues associated with inpatient and outpatient care. Beginning in 2020, we started to provide estimates for revenues from telemedicine services. And lastly, the Service Annual Survey disseminates estimated patient visits for select ambulatory healthcare industries. And I'll show some examples of these products. We provide estimates on inpatient days and outpatient visits for all 6 of our hospital NAICS. Estimates for both inpatient days and outpatient visits declined between the years 2019 and 2020 for the NAICS featured on this slide, which is government, general, medical, and surgical hospitals. For hospitals, not only do we provide total revenue estimates, but we also provide net patient care revenue and a breakdown of that into net inpatient and net outpatient care revenues. For the NAICS featured here, privately owned general medical and surgical hospitals, net patient care revenue and both inpatient and outpatient care revenue declined between 2019 and 2020. So this slide features our newest data product, revenues from telemedicine services. We began working towards collecting data on this a few years back, but it really became a priority when the pandemic hit, as healthcare providers and healthcare businesses had to adapt to the circumstances and look for new ways to provide care. The Service Annual Survey published estimates on revenue for telemedicine services for the first time with the 2020 release, and we do plan to continue to collect this data. While many of us heard about or even utilized telemedicine services for the first time during the COVID-19 pandemic, telemedicine existed before COVID-19, and industry experts do not think that telemedicine will retreat as we hopefully emerge out of this pandemic. It could even reshape some aspects of the sector overall, and we're excited to continue to provide content on this topic. Data on revenue for telemedicine services is provided for almost all NAICS except social assistance, and we also omitted some industry groups like ambulances and laboratory services where it's just not really germane. On March 17th of 2020, the Centers for Medicare and Medicaid Services expanded telemedicine coverage to include mental health services and behavioral health screening. And this slide highlights some of the revenue estimates and the revenue from telemedicine estimates for NAICS that provide those services, including offices of physicians, offices of physicians specializing in mental health, and mental health practitioners. And providers in that last category are going to be things like counselors and psychologists. Of the industries on the previous slide, doctors and practitioners specializing in mental health services showed an increase in patient visits from 2019 to 2020. The rest of the NAICS featured on this slide, such as dentists, doctors not specializing in mental health services, and chiropractors, reported a decline in patient visits between the same years. Some of the industry groups on this slide were able to increase their patient interactions despite the challenges of the COVID-19 pandemic, while others saw a decline in their patient interactions. And again, the data featured on this slide and in all the slides is just a snapshot of what the Service Annual Survey provides in terms of healthcare content. And I hope you enjoyed hearing about our data, and I encourage you to explore it more on our website. And with that, I'll pass off this presentation to our next speaker, Aaron.
Thank you so much, Caroline. Hi, everyone. My name's Aaron, and in my branch, the Business Owners Branch, we currently produce two main data products, the Annual Business Survey, ABS, and the Non-Employer Statistics by Demographics, the NESD, and both can tell us a lot about the healthcare industry. The most recent full release of the ABS, the 2020 ABS, covers data year 2019. This survey is sponsored by the National Center for Science and Engineering Statistics, the NCSES, within the National Science Foundation. The survey covers firm count, owner count, sales, number of employees, and payroll by race, ethnicity, veteran status, and sex, as well as various business and owner characteristics changing every year. The ABS also stratifies this data by employment size, receipt size, and years in business. This data is available at the national, state, and metropolitan statistical area geographies with 2 to 3 digit NAICS. In the 2018 ABS, we have a bit more availability with 2 to 6 digit NAICS in combined statistical area, metropolitan division, county, and place. The ABS is released annually, and we currently have preliminary data for the 2021 ABS available right now, with the final data expected around the end of 2022. The data can be accessed at the link provided, and it also includes an API. As you may have noticed, the non-employer statistics by demographics data doesn't have survey in the name. That is because, unlike the ABS, the NESD data is not collected through a survey. It is created through businesses filing IRS tax forms for sole proprietorships, partnerships, or corporations. The NAICS status and sales are from another data product, the non-employer statistics, NES, and the demographic characteristics are assigned to the non-employer universe from administrative records. The NESD covers firm count, owner count, and sales by race, ethnicity, veteran status, and sex. And these are stratified by receipt size and legal form of organization. The statistics are available at the national, state, and MSA level with 2 and 3 digit NAICS. Like the ABS, the NESD is released annually. The most recent data available is the 2018 NESD covering data year 2018, and 2019 NESD data is expected at the beginning of 2023. The data can be accessed through the same link as the ABS data, and it also includes its own API. So, what can these data products tell us about healthcare? Well, let's start with an overview of where Sector 62 falls within the rest of the firms in the United States. As we can see here, the healthcare industry provides about 2.8 million of the 32 million combined employer and non-employer firms in the United States. Of the 128 million employees, healthcare contributes about 19 million and contributes a little under 1 trillion of the $7 trillion payroll in the United States. At the 2 NAICS level, sales in the ABS are provided in ranges, as we cannot provide exact numbers without compromising publication standards due to high sampling variability, poor response quality, or other similar concerns. Using this range, we can see that healthcare provided over 5 trillion of the United States' total 39.7 trillion sales. Now, while this is a good starting point, we can break down these 4 statistics provided much further. I will show just one example with firm count. Here, we can see the basic demographics of the 2.7 million healthcare firms in the United States in 2018. Just as a preliminary note, the not classifiable section of these graphs is a combination of firms either unclassifiable by these demographics or firms equally classifiable by both demographics, such as equally owned by male and female. These numbers were so small it made more sense to combine them. Often, these distributions fall where you would expect, with the smaller population having the fewer firms. For example, with Hispanic firms being 13% of healthcare versus 84% non, and veteran being only 4%, with 92% being non-veteran. But some proportions are much closer to each other. For example, 39% of healthcare firms are owned by a racial minority, and 64% are female-owned. In addition to the raw demographic numbers, both the ABS and NESD provide select owner and business characteristics, which can also be useful in understanding the healthcare industry. I'll show a few examples. Here, we can see the field of the highest degree held by healthcare business owners in 2019. Obviously, the highest reported was a health-related degree, but inspiringly, the runner-up was no degree, even higher than biological, which you would think would be the natural next highest reported. Just a caveat here, the ABS owner data isn't representative of all of the owners in the United States. It only covers the respondent owners themselves. That being said, it can still be useful for at least getting an idea about healthcare owners in the United States. Now, on the other hand, business characteristics are representative of all of the businesses in the United States. Here, we can see a comparison of the rate of working from home for healthcare businesses versus the other industries in 2019. Of the 2.7 million reported employer businesses in the United States, about 750,000 work from home, compared to 64,000 of the 300,000 healthcare firms. This is about 28 versus 20%, which is closer than I would have thought, as I personally usually think of healthcare as a hands-on, in-the-office kind of industry. Like the ABS, the NESD also has owner and business characteristics. Here, we can see the ages of healthcare firm owners in 2018, and it looks very similar to a normal distribution, with the most common age being between 35 and 44, and the ends being a little more weighted towards the 65 and over side versus the younger of under 25. On the business characteristic side, we see a far more lopsided distribution of the legal form of organization of non-employer healthcare firms in 2018. As we can see, individual proprietorship accounts for the vast majority, being over 10 times greater than the combined C and S corporations and partnerships. As an aside, it turns out this distribution is very common for non-employer firms in most industries, and it is not a healthcare unique phenomenon. What I have shown so far is just a small sample of the various business and owner characteristics we have available. We also add new ones and replace old ones every year in what we call module characteristics. Some examples of interesting characteristics that I didn't cover today, but are or will be available online, are the source and amount of startup or acquisition capital, business profitability, the reason a given business ceased operation, highest level of education completed by business owner, rather than the fielded degree achieved, which we saw earlier, whether the owner was born in the United States or elsewhere, the kind of military service performed by a veteran owner, if applicable, and the impact of coronavirus on sales. All of these, except the final characteristic, are already available, with the impact of the coronavirus to be released with the 2021 ABS at the end of 2022. So, if you are interested in looking at our data, here are a few links. All the links I provide and more, for example, the methodology and other technical documentation, can be found on our landing page, linked here. Here, we have a link for our data page, containing links to the data tables and APIs for the ABS and NESD. The News and Update link leads to our News and Updates page, which contains release information when it becomes available. As I mentioned before, the 2021 ABS and 2020, we recently amended this. The 2021 ABS is expected at the end of 2022, while the NESD data is expected at the beginning of 2023. My bad. For further questions on data usage, release dates, and anything else ABS related, you can call our general helpline, our branch line email for more data use driven questions. And you can also reach out directly to me by phone or email if that is easier. And with that, I turn it over to Amanda. Thank you so much, guys.
All right, thank you, Aaron. All right, thank you all for attending today. We've had some great speakers from our economic programs. My name is Amanda Klimek. I am here presenting with the American Community Survey. So the difference in what we've presented so far today, the data that you've seen earlier is all of our great data that is available for healthcare for businesses. And so that is collected from establishments, and the data that I'm presenting is from the American Community Survey, which is collected from households. So this can give you a great demographic and socioeconomic breakdown of the area you're looking in or your community, so on and so forth. And I can talk about the healthcare applications of that as we go. So to start out, the American Community Survey, or ACS, is the nation's most current, reliable, and accessible data source for local statistics on critical planning topics such as age, children, veterans, commuting, education, income, and employment. We sample approximately 3.5 million addresses, and the data are collected continuously every year to produce annual social, economic, housing, and demographic estimates. And the ACS is used to distribute more than $675 billion of federal government spending each year. The estimates cover more than 40 topics and support more than 300 known federal uses and countless non-federal uses. Businesses and communities use these estimates to make vital decisions, including where to locate hospitals and schools, what transportation needs exist, and what goods and services businesses should provide to customers. And we typically release 3 different sets of pre-tabulated estimates in the form of 1-year and 5-year period data sets, as well as 1-year supplemental estimates. So the data products are released 1 year after the data are collected, and the data are generally released in September the year after collection as 1-year estimates. And so the magic number here is 65,000. These are available for geographies with populations of 65,000 and above. And then we have the 1-year supplemental estimates, which are a selection of popular detailed tables. And those are released a month later in October as 1-year supplemental estimates. So those are available for 20,000 and above. And then the 5-year estimates are released generally in December of each year, and they cover every other geography down to the block group level. So you can think of the 1-year estimates as the nation state, larger counties, congressional districts. We have several larger geographies available in the 1-year estimates, and you can compare those from year to year. And it was a little different with our 2020 data release schedule due to data collection issues due to COVID-19. If you want to learn more about that and future data releases, you can view the data release link on the slide on the screen. So I talked about the social, economic, demographic, and housing topics that we cover. And this is a really great slide to show you a selection of some of the topics that we offer in the ACS. So on the left here, we have social characteristics such as fertility, language, disability status. And in the middle, the demographic characteristics, you might recognize that this is the same information collected on the Decennial Census. So the 2020 census that just happened, this is the same basic demographic information that's collected. And you can cross-reference it with any of these other categories. So below that economic, we have economic data that is collected at the household level. So, median household income, health insurance, so on and so forth. And then on the right, housing, we have both the financial and physical characteristics of housing. So the physical tells us, a little bit about the housing stock, access to certain, plumbing facilities, so on and so forth. And then the financial is housing burden. So stuff like gross rent and monthly owner costs and some of that. And on this next slide, I just kind of show, maybe a selection of some of these topics that might immediately jump out as useful for if you're looking at healthcare in your community and sort of health statistics. So going further into the geography that we cover, so we cover many different geographies, and the ACS's unique ability to report on a wide range of geographies is what gives it such a broad appeal. So we cover more geographies on an annual basis than any other household survey. And I like this slide because you can see how different levels of geography interact with one another. So the lower levels of geography fit neatly within the larger ones that are directly connected with lines. So congressional districts, school districts, and places, which you can think of as cities, towns, or other municipalities, fit neatly within states and don't cross state boundaries. But they may cross boundaries of counties or metro areas since they're not directly connected to lines. So it'd probably be good to talk about how to think about our data. So generally our data are available in either profiles or tables. So on the left here, you can see tables, and you can see the letters in parentheses that correspond to the sort of the table name will show you, will show you what that table is. So when you're looking at a table ID, if it starts with B or C, you will know it's a detail table. If it's S, you will know it's a subject table. And basically everything is built on the detail tables, and the subject tables cover a general topic and take in several of the smaller detail tables to sort of give a broad picture of that particular topic. And then on the right, we have profiles. We have data profiles, which cover, we have 4 of them, and they cover the social, economic, housing, and demographic characteristics. There's one for each of those broad categories, and they show you a selection of the most popular topics within each of those categories. So the data profiles are a really great place to start when you start looking at different, different ways to get a broad picture of a community. And so, sort of going into that, I'd like to talk about some of the ways that people are using our data for healthcare applications. So we have several data user stories published on our website that are relevant to healthcare, but I'd like to highlight a couple of them. And I'm actually going to go quickly to the live site to do this real quick. So I'm just at census.gov/ACS. And if you go to About the ACS and then ACS data stories, you can see some of these. You can read more about some of these. So the American Psychological Association used ACS data to portray a need for a more diverse psychology workforce in the United States, especially with the growing need for, therapists who work with a diverse population, especially, in the last couple of years, there's been more people seeking mental health services. And so the APA used our demographic and socioeconomic data to identify sort of the discrepancies between, mental health providers and those seeking services. And they made a really, really great dashboard that had some outcomes that affected funding. And then the St. Joseph Community Health Foundation used our data to identify populations in need in their community for, allowing them to do outreach and funding for different community organizations. And this one I actually want to click on and highlight because I want to show you how these data stories are structured. So it gives you an overview of what happened and what they did with the data. And here's the outcome. Here's the sort of so what. This led to you can see the outcome. This led to $50 million worth of low income housing tax credits. So about 30% of the state's available credits. So you can kind of see that they were able to use this dashboard to actually create outcomes in their communities. And one of the things I really like is at the bottom, you can see ACS topics used. So you can see exactly what different ACS topics they used. And so you can get an idea for how other organizations are using our data. And so you can kind of get some inspiration for, what you can do with it. And I want to actually take you to the City Health dashboard. And I'm just going to go ahead and take a look at, here's Atlanta. And there's a lot of different topics in here. And, there's a lot of topics that come from other surveys and programs as well outside of census. One that I definitely know actually has ACS data in it is housing cost. So this is excessive housing cost in 2019. This is actually, it says 2019. This is from the 2015 to 2019 ACS 5-year data. And so you can go in and you can see more about this metric, and it talks about it right there. And you can go into the complete metric information and you can see exactly where they got the data from the ACS. And I really like this because it shows that it's replicable. So this is something that you can also do for your organization. So we really like when you use our data to sort of show how you used it so that other people who are interested in using it can sort of replicate what you were able to do. And so on that note, I want to take you to data.census.gov. This should look familiar by now. So earlier, Tara went over some of the basic functionality on data.census.gov. So I'm going to focus really just on the content. So I'm going to the advanced search. I'm going to go ahead and put in my geography. So we just looked at Atlanta. So I am going to, rather than look at the metro area, I'm going to look at Atlanta. I'm going to look at Atlanta proper. So I'm going to go into place and go to Georgia. And I am going to, let's see, I'm going to go down and click on Atlanta City, Georgia. I am going to go to surveys and ACS 5-year. And we're going to take a look at those data profiles I showed you earlier. So this is demographic and housing estimates. This covers, general sex, age, race, all of that stuff. And social, we talked about some of that earlier. So, households by type, relationship, marital status, fertility, so on and so forth. So this is a really great place to look at these data profiles and get information, get a general overview of the community. Economic has a lot of the topics I listed earlier. And then housing, if you scroll down in housing, you will get a couple topics on gross rent as a percentage of income and selected monthly owner costs as a percentage of income. As we expand out, we can see that there. And so these are some of the areas where they were able to get that data from to build that dashboard. So this is what they were looking at with excessive housing costs. So you can also look at some other. I'm going to go ahead and take out this data profiles filter. You can go ahead and go to the topics filter, and you can look at other tables that just specifically relate to healthcare. So there are health insurance tables, disability tables. So if we were to go to health insurance, we would see a subject table. And I covered earlier, a subject table provides a broad picture over a particular topic. So this is the characteristics of health insurance coverage in the U.S. So, it breaks down age and then insured versus uninsured. And it gives you a portrait of the insured and uninsured populations and gives you that demographic breakdown. So that's where we can see a lot of the value in being able to cross-tabulate all these different broad categories. So I'd like to go back to slides now. So we took a look at data.census.gov. So you can always, go to our website and learn more about how to learn about data.census.gov. This link at the bottom of the slide has some great how-to guides. You can also learn a lot about any ACS topics through the ACS website. I showed you, you can find data user stories there. You can look at the technical documentation if you want to know anything about a particular topic, how it's defined, what's included in selected monthly owner costs. That is available in our technical documentation. You can find, all kinds of information. If you have any questions, feel free to browse our website. And if you end up using ACS data for a story, kind of like, one of the ones I shared today, please go to our Share Your Story feature and share it with us, because as you can see, we really do love sharing what people are doing with our data. It helps others. And another way you can do that is through the American Community Survey Data Users Group. We have conferences every year, we have conferences every 2 years. We just had one last year in May of 2021. We have one next year in, tentatively would probably be in May of 2023. So we put out a call for proposals, probably sometime around October, November. So if you have anything you want to share at our conference, feel free to, keep an eye out for that. Go to acsdatacommunity.prb.org, and you can join the free online user group where you can go in and sort of talk to other data users and ask questions and show how you're using the data and get inspiration as well. And so it's a really great place to sort of network with other ACS data users. And that wraps up everything I have. I'd also like to point out Census Academy was pointed out earlier. That's a really great place to learn about a lot about this too. But I'm going to hand it back over to Linda to wrap up and talk about how you can connect with us.
Thank you everyone for your interest and time attending today's webinar. Thank you Tara, Caroline, Erin, and Amanda for presenting our audience with a wide range of data that we have from the Census Bureau on healthcare. Now, before we begin our Q&A portion of this webinar, please take note of the contact information on this slide for anyone that may be interested in hands-on in-person training. As Tara mentioned earlier, we have data dissemination specialists that are available to provide this service. As a reminder, we are focusing our Q&A on today's topic and we'll be accepting questions related to today's topic. If you have any other questions on other topics, please feel free to send us an email at census.askdata@census.gov. For now, to ask your questions, please use the raise your hand feature and our facilitator will unmute you so that you may ask your question. All right, while we are waiting for questions to come in, I did want to mention a neat data tool that we have. It's called the Census Survey Explorer. This is a data tool that allows you to find out which data surveys have the data on the variables that you're interested in. So for example, if you were interested in, let's say, a variable like employment, you want to know about employment data, you'll be able to find exactly which of our surveys has this data. It can save you a lot of time looking for data, especially if you're not familiar with our programs. And even if you are, it's a nice way to reassure yourself that you've got all the data that we can offer on the topic. Let's wait a few moments and see if we have questions coming in. All right. So I also want to mention that we have also another tool called the My Community Explorer. This is a neat tool where you can see business and demographic data about your community in a quick and easy to use format. And I highly encourage you to check it out if you have not. Let's give it another few minutes for anyone who may be trying to formulate their question.
Hi, Marguerite. I have a question about the data sets or the dashboards. You'd mentioned, I think it was American Psychological Association had its own dashboard they created using the data. I'm wondering how that works with other federal agencies. For instance, we're interested in health data, but health data related to returning citizens as well as individuals who are currently incarcerated, and wondering if there's like an intersection of justice data with the health data, or has DOJ set up its own dashboard using ACS data that we should look. So we should look for Bureau of Justice Statistics to see what they're doing with ACS data. I'm just wondering, where will we find that type of data? Would it be here, or would we look to see what agencies have done with their use of data from the ACS?
Hi, Marguerite. This is Amanda. Yeah, if it's possible that DOJ has used our data for a similar application. If they have not reached out to us. So if they have used it for a similar application, and they would and if they would like to reach out to us and have us promote it, we're absolutely happy to. But yeah, I would reach out to them and kind of maybe see if they've done something similar, or even if they have similar data and maybe other members of the public or other organizations have made their own dashboards with using DOJ data.
Okay, thanks.
Thank you, Marguerite, for that question. Let's give it a few minutes and see if anyone else may have additional questions. All right, let me check in with my colleagues on the Q&A panelists. Have all the questions been handled? I do see a question from Alice regarding joining the webinar late. So it will be available on our site on census.gov. You can find it under Census Academy, and it should be available within 2 weeks. That is the time frame that we target for. All right, unless I have missed a question. All right, so without the absence of addition, oh, go ahead.
No, Linda, this is Caroline. John asked a question about how often the data in each programs were adjusted, and I responded for the Service Annual Survey, but if others wanted to respond for their programs.
Perfect, thank you for that. I missed that one. Okay, I do not believe we have additional responses on that. Let's give it a few moments to see if anybody may want to ask a question over the telephone. All right, without the absence of additional questions at this moment, I would like to express our thanks to everyone again for attending today's webinar. And this concludes today's presentation. I hope everyone have a great day. Thank you. Bye-bye.